Well, with trigger finger, the word trigger is describing the mechanism rather than the finger you pull a trigger with, either on a hand tool or a gun. So what a patient will describe is when they make a fist and they try and straighten the fingers out, all the fingers will come out and then one of them gets stuck and it won't move, and then it suddenly pings out straight, and that's the trigger mechanism, and that's what's called trigger finger. Not necessarily. Most cases with trigger finger, it just occurs. There are some conditions that are associated with trigger finger. For example, diabetes. You can more likely get trigger finger in diabetes compared to general population without. Also, you can have some fibrous conditions in the palm where you can get fibrous thickening in a condition called Dupuytren's contracture or Dupuytren's disease. And that can be linked to triggering as well. But in most cases, it's just spontaneous and there's no underlying cause. It can do. I think in most cases, it probably doesn't. However, you can try to heal it on its own with anti-inflammatory medication. Also, you can splint the finger straight at night. So it rests the finger and stops it from triggering at night time, because the triggering is when you get some rubbing of the tendon at the entrance to the tunnel that the tendon runs in, and that rubbing causes a thickening in the entrance to the tunnel and in the tendon, and that's what catches when it goes up and down. So if you can keep the finger straight at night time, that might be enough to rest it. So they are the conservative measures, but they don't always work. Well, you can try with those conservative measures, but I tend to, as a first line treatment, put a steroid injection into the area. So you have a steroid injection into the palm just here, and it's thought to work by softening the entrance to the tunnel. It therefore stretches out and the swelling in the tendon goes down and it stops triggering. And that will cure it in about 2/3 of patients. The next line of treatment is, if that doesn't work, or even if it does work and then it wears off, if it's lasted for many months, 6 months or so, then it's an option is to re-inject it and put another injection in, and you can do that. The surgical option, if the injection fails to last long enough, is to do an operation where you have a local anesthetic in the palm, a small cut just over the entrance to the tunnel, and then you effectively just release the tunnel, and it gives it more room for the tendon, and then that cures the condition. I think it's probably worth seeing a doctor pretty soon after it starts, because in most cases it's unlikely to go away. So I'd book and see a doctor fairly early, and a lot of doctors, including primary healthcare physicians such as general practitioners, can inject these triggers. And also in the NHS here, there are hand therapy injection clinics that the GP can refer to directly as well. So I would go and see a doctor fairly early on in the condition. It doesn't always require surgery, because most of them will resolve with a steroid injection or 2 steroid injections. But in some cases where that doesn't make it go away, then surgery is a good option, and it's a good operation. It's very reliable. As far as operations are concerned, it's probably one of the most reliable operations for getting rid of a condition.